My name's UP Tripp. I'm Community Engagement Officer and a cycle instructor for Wheels for Wellbeing. Yeah, Wheels for Wellbeing was originally established around sort of 2007 in Croydon by a group of parents, and they all had young people, children and adults they were caring for with learning disabilities, physical disabilities, a range of disabilities who just weren't getting any exercise. Sort of disabled people will go along with all their families. And we've grown from there really, so as a group of families, and now we have 4 different venues across South London. It was the second year we'd been involved with the London Deanery for Team Up, the first time for me, so it was new to me sort of meeting the London Deanery. I wanted to be involved in Team Up having read the case study from the previous project, and one of the guys who was involved in that was still in touch with us and still keen and still talking. I can't remember what his job was, but he's worked somewhere in the NHS, and he was still talking about what he'd done with Wheels for Wellbeing. We were always keen on getting the message out there, and Team Up's the only way I know of doing it. But what we wanted them to do, so we were looking for sort of 3 or 4 people, doctors, occupational therapists, a mix of people, to put on an event for us. So as part of one of our regular cycling sessions, to come along, but for them to put on an event and invite all their colleagues, because we were very keen on making much better contacts within the medical profession, and also understanding the language that appeals to them, so that GPs would refer people to us. So it was a really wonderful kind of learning experience, even from day one, finding out like how they talk about people, because we say people, they say patients. I mean, that's an obvious difference. Was this poster. And apparently that's what you do now in research. You present a poster. So yeah, I didn't know that. So now we've got this poster that we know that they went to 1 conference with it already. So yeah, again, I think that helps you communicate in the right way to the right audience, which obviously we weren't. So as part of it, as well as putting on this event, Winning Wheels, and inviting all these GPs, They also interviewed quite a few people in depth and wrote up a couple of case studies about how people's health had benefited from getting involved in the cycling, but also sort of the social angle, doing an activity where they're included, all their friends can go together. Because I think some of them have found that you're diagnosed, you've had a stroke, you go to the stroke group and you meet lots of other people who've had strokes. But if you come along to Wheels for Wellbeing, you meet people from all different areas, you meet all ages, families cycling together, individuals who come with their husband or their wives, or people that just rock up on their own because they want to cycle. So I think it was to try and dig out the benefits of that for people through the case studies on one side, but the event was to sort of say to the medical, the GP team, yes, it's obvious you get exercise if you cycle, but what you get here is companionship, a whole social group. One of our case studies was a woman called Linda. So she was, I think, she's been cycling with us for a while, for a couple of months, with a sort of group of 4 of them. But Linda is deaf, so when you talk to her, you have to make sure she's looking at you. And so instead of the interview, Louise sent her a list of questions and then got the questions back and then asked for clarification. But I think through that whole process, we all got to know Linda really well. Because at sessions there's lots of other people there and she's with her 3 friends and they all chat and they're all talking together. But I think that's really helped build the relationship, because after that I spent a bit more time at the velodrome talking to different people. And then with Linda's group of 4 now, we started taking them on the road. Over the summer we linked up with Southwark Cyclists, a volunteer from Southwark Cyclists, and pretty much every 2 weeks on a Monday we've been getting to the velodrome early with Linda and her 3 friends and going out on the road. So that's a massive step. And in fact yesterday I met them down there and they cycled up to the top of Brockwell Park on tricycles. So it was absolutely fantastic. That's what the Team Up project helped convey to sort of the GP surgeries locally, and also other people, because one of them was an occupational therapist, and it's massively important for us to have really good relationships with that whole kind of area of medical model, as they call it. The first time the two guys who did a lot of the project in particular, yeah, Louise and Anand, we got some fantastic pictures of them cycling on side-by-sides, and they realised what a social, fun activity it is, but amazing health benefits because you're outside in the fresh air. And our Team Up volunteers were just lovely people. So they were easy to work with. They're professionals. You know, they've gone through all sorts of training. When you're asking them to, you know, they did some research questionnaires. They did a couple of interviews to write case studies. You know, the quality of the work was fantastic. I didn't have to sort of double check anything. Completely different worlds that they would never have met. Certainly never worked really closely together on a project, but they had such professional respect for each other's areas. So they were really interested. Oh, well, is that how you work? Oh, right, this is what I do. So I think that they learnt a lot from each other. I learnt a lot from all of them, communicating, if you like, with medical profession. I think it opened a lot of doors for us. Like, we were invited to the Southwark GP Learning event because of the Team Up guys phoning the public health people, having conversations with them. So we were invited along to have a stall and talk to all the GPs. I think there was about 100 GPs, which was fantastic. So one of the other outcomes was the two guys in Team Up, Louise and Anand. I haven't said enough about them because they were brilliant. To invite two complete strangers to come along to our events, to come along to our cycling session and interview them, but they were absolutely fantastic, both of them. Louise, Anand, kept saying, "You've got such good bedside manner." But they really did, and people warmed to them and opened up, and you know, there's two particular case studies they wrote up which were really good. I think for a lot of them it's meeting people and realising that they're human as well, because normally you know, you only meet a medical person in a hospital, or you only meet them at the doctor's. Here you're meeting them in your place, doing something you love, showing them how healthy you are. That's it. And I think it's really important, you know, that GPs are seen as humans and occupational therapists, because you just see the job title, you don't see the person. So I think getting out there and being in a different space, the chance to get out, I think they'd love it. I mean, they were on the bikes, they didn't get off. We've decided to do something, if you like, slightly bigger, so we've got a bigger team, so we're going to have hopefully 6 people, so that we'll have 2 at each of our venues, because we've got the 3 different venues, Ladywell, Croydon and Hernhill Velodrome, and they're going to do more of a kind of longitudinal research project. So what we want to do is they're going to meet up with a group from each venue, interview them now, do some research with them now, questionnaires on their well-being, their health, then go back in 3 months and then go back in 6 months, because what we don't have from our point of view is research over that period. Relationships, that's what it's about. 3 words. Fun, education, relationships.